Hello, Sophia. Hello, Marie. Hello, everybody. I am very pleased to be with you tonight for this event on canine vaccines. And today we're going to talk about canine core vaccines. The first point is to think about what is a core vaccines and what are the criteria that has been decided for a core vaccine. And as you can see, we have three criteria. The first one is to know if the disease is a very dangerous disease, which means do we have a high level of mortality, do we have efficient treatment or not. The second point is, of course, the epidemiology and the degree of infectious risk for the different animals. And of course, because we talk about vaccines, we need to think about the vaccine efficacy. And when combining those three criteria, we have the core vaccine and the non-core vaccines. So today we're going to talk about core vaccines, and I want to make a short presentation about the main vaccine that are available, the disease corresponding with the infectious risk and the level of efficacy of each vaccines. So for dogs, the core vaccines are parvoviruses, distemper virus, and adenovirus with hepatitis. We also have vaccines against leptospirosis, and I think you're all aware that we have also vaccines against rabies. And the rule is really easy. When we ask who do we vaccine, the answer is all dogs for the core vaccines. But once we have said it's all dogs, the remaining question is how can we vaccinate correctly? Which means that we have to know a little bit of the biology of pathogens, of course, how the vaccines work, and the different characteristics of the dogs we are going to vaccinate. And we are going to start by the vaccines biology. The pathogen biology. And we start with the first one, the parvovirus. So parvovirus, as you all know, is excreted with feces, and we have a contamination by orophageal routes. And one of the characteristics of this parvovirus is its high stability, is the in the environment, which means that more or less all dogs are at risk. Nevertheless, we know that some risk factors have been demonstrated, like the age. Young dogs are more susceptible to the infections, the population density, and of course, the absence of vaccinations. It is also important to note that dogs sick, of course, but also asymptomatic dogs can excrete the parvovirus in the environment. And if we mix all these informations, we know that we have a very resistant virus that can resist to heat, and most of the disinfectant we classically used in clinics. It's a strongly virulent virus with a mortality ranging between 20 to 90%. And it's a highly contagious virus with direct contact, but also, and it's very important, indirect contaminations. So we need to keep in mind that the infectious risk is permanent for all dogs. So what about the two other diseases due to viruses? The first one is the distemper viruses. So I want to remind you that for non-vaccinated dogs, it's a deadly disease. And the question is how our dogs can be contaminated. It's quite a non-resistant virus, so we need direct contact between the animal that will excrete the virus and the future contaminated dogs. The main risks are of two categories. The first one is the wildlife, because we know that the virus is circulating in the wildlife. But the second risk is also non-vaccinated dogs. And we know that when we don't vaccinate enough dogs, we can have epidemic of distemper disease. We have something quite similar with the adenovirus that is responsible for the infectious hepatitis. Once again, it's a deadly disease, and the source of contaminations are more or less the same, the non-vaccinated dogs and the wildlife. But the main difference is that we don't need a direct contact between the reservoir and the dog, because probably the main infectious sources of virus is urine of infected animals. So indirect contamination is a very easy way to contaminate dogs. So now that we have seen the risk for the dogs, the question is, what are the clinical vaccine efficacies? So if we made a rapid round around parvovirus, distemper, and infectious hepatitis vaccines, it has been clearly demonstrated that those vaccines confer protections against clinical signs. When we look at the experimental infections, we also have a protections against infections, but globally, on field studies, the vaccine not always protect against infections, but nevertheless induce a reduction of the viral excretions. What is important is that for these 3 vaccines, the clinical efficacy is almost 100%. And just about this vaccine, I would like to do a short focus on parvoviruses. You know that at the beginning, we had first parvovirus, the CPV2. And this CPV2, when it arrives on dogs, rapidly mutates. And we had new variants that arise, CPV2A, then 2B, and then 2C. And the first virus disappeared and is not circulating anymore. And if you look there, you can see that all around the world, we have the 3 CPV variants that are present. And the question is, are the actual vaccines still efficient against those variants? And the answer is clearly yes. At the day I am speaking, no data indicates a lack of vaccine efficacy against the 3 variants viral. So we have rapidly looked at viral vaccines. Now, what about leptospirosis? So the first question is, how do our dogs can be contaminated? So the source of contaminations, once again, is urine contaminated with the bacteria. And the question is, who are the reservoir? And more or less, we can identify 3 types of reservoir: the dogs, the rodents, and the wildlife. So each time a dog is in contact with urine contaminated or water contaminated by urine, it's at risk. And once again, it's a deadly disease for dogs. And in addition, we must remember that it's also a zoonosis that can give serious clinical signs in humans. So regarding leptospirosis, what do we know about vaccines? We have 2 kinds of vaccines. The first one is what we call now the L2 vaccines. In this L2 vaccine, we have 2 serogroups, Canicola and Ichthyohemorrhagiae. Canicola, the main reservoir, is the dog, and for Ichthyohemorrhagiae, the main reservoir is rodents, and more precisely, rats. So we have really to keep in mind that where there are humans and dogs, there are leptospirosis, because rats are where humans are. So it's for the first kind of vaccines. But we also have other kinds of vaccines that are called IL-4 vaccines. And in these IL-4 vaccines, we have once again the serogroup Canicola, the serogroup Ichthyohemorrhagiae, serogroup Grypotyphosa. And for the European vaccine, we also have the serogroup Australis, and in North America, the serogroup Bona. What do we know about those 3 serogroups, more or less that the reservoir is both wildlife and cattle. But if we look at the repartition of the different serogroups in South America, if you see there is a study published in 2022. It's a Colombian study. And what you can see is that Canicola and Icteromyces are the more prevalent serogroups found in dogs. Now that we have seen that we have different vaccines, the next question is, what is the vaccine efficacy in dogs? And if you look at this study, you see that vaccinated dogs are protected against clinical signs and more or less the vaccine prevents the bacterial excretions. So it also prevents the transmissions to humans. But you have to keep in mind that there is no cross immunity between the different serogroups. So even with the IL-4 vaccine, you won't have a universal protection, meaning that, for example, if your dog is vaccinated with the L4 that does not contain Pomona and is infected by Pomona, it will do a Leptospirosis. And I want to do a short focus on the last very important vaccines, the vaccines against rabies. So, of course, you know that it's a deadly zoonotic disease, and I'm sure that in your countries, you are much more aware of the importance of the vaccination of dogs against rabies than we are in Western Europe. So, the reservoir are, of course, the wildlife, but also the stray dogs and cats. And you know that the contamination can be done by biting, scratching, or even linking. And what is really, really important is that vaccines protect against the infections. So it means that if you have a dog that is correctly vaccinated against rabies, there is no more risk of virus transmission to other dogs, but mainly to humans. So it is really clear that vaccination of dogs is really the best strategy to reduce the human contaminations. So in this first part of the presentation, we have seen the disease and the level of vaccine efficacy. Now it's important to understand what are the different types of vaccine that we can use and how it works to adapt at the best the vaccine protocols. So the first kind of vaccines are modified live vaccines. And for these vaccinations, you see that the wide strain has been attenuated in vitro with different strategy, which means that it has lost its virulence, but it has kept its immunogenicity. Just a small point about the loss of virulence. It's an attenuation. We still have a live vaccines. So it's an attenuation if we have a competent immune system. So we have to keep in mind that we need to follow certain rules to correctly use this live vaccine. We avoid vaccinating very young dogs before 4 to 5 weeks of ages. We avoid vaccinated pregnant bitches, and we don't vaccinate immunocompromised dogs because they are infected by immunosuppressive agents or because of different disease. It's something very important. So now that we have seen the safety part of the live vaccine, I would like to come back to the immunogenicity of these vaccines. This vaccine will replicate in dogs, and it will allow us to mimic the natural infection. And clearly, those modified live vaccines then induce strong cellular and humoral immune responses with inactivation of cellular immunity and cytotoxic T cells, but also humoral immunity with neutralizing antibodies. And if we look at what we know about immunogenicity, we know that one injection is enough for a good primary immunization. We also know that when we have a robust immune response that is induced, we have a duration of immunity for at least 3 years. And once again, it induces a complete immune response with a cellular and humoral immune response. But we have to keep in mind that those live vaccines have one strong weakness, which is the maternally derived antibodies. So as I told you, those vaccines can replicate in the organism, and this replication induces the immune response. But if we have maternally derived antibodies, they will prevent the infections of the cells, and they will by the vaccine, and they will prevent the replications of the vaccines. And then there will be no activation of vaccinal immune responses. So we know that we will have to adapt the protocol when using modified live vaccine in dogs that still have maternal-derived antibody. And what is difficult is that we know also that we have a strong variability in the level of MDA depending on pups, on the degree of immunization of the dam, or the amount of colostrum that has been given to the pups. And as you can see, you have there the level above which the vaccine will not be efficient, and we have the level of protection. So if you have a small level of MDA, you can obtain a good vaccine response very early. But if you have a high level of maternally derived antibody, you will have to wait several more weeks before obtaining a good vaccine response. And I'm sure that Mary will explain you that later very well with the adaptation of the protocol. So second type of vaccine is what we call inactivated vaccines. So those vaccines are composed either with the complete pathogen that has been inactivated, or sub-unit vaccines, so antigen derived from the pathogen. What is important is that these inactivated vaccines are non-replicating vaccines. So it means that we, of course, regarding the safety, have no risk of residual virulence or reversion. But on the other side, we also know that it induces a lower immune responses, and this response is mainly a humoral response with antibodies. And this will have consequences for the protocol. We know that we need at least 2 injections there to induce a good memory response. And you need to be careful between the interval between injections. Second point, the response will be mostly almost humoral, and with a duration of immunity that is much shorter than what we have for live vaccines. But since it's a non-replicating vaccines, we know that we will have no to low interference with MDA. So these vaccines can be used in very young pups without difficulties regarding MDA. So we have seen the pathogens, we have seen the vaccines, but we need now to discuss about the dog we are about to vaccinate, and more especially how their immune response will be, their immune system will be able to respond to the vaccine. So the first point is the age of the dogs. And we'll start with very young dogs, so puppies. We know that the rule is to say we have to vaccinate as soon as possible. But what do we mean by as soon as possible? When can we start? And we have to keep in mind two important points. The first one is that puppies have an immature immune system. And the second point, I already talked about that, is the MDA interference. So I will just say a few words about the maturity of the immune system. Of course, the immune system of dogs is competent at birth, but it's totally naive. So it has never been stimulated before. And we also know that the immune response of these pups is much lower than what we can observe in adults because of different reasons. The first one is that at birth, we have a flow of immunosuppressive hormones that block the maturation of the immune systems of the pups. We also know that at birth, the immune system of the pups is still quite immature due to the fact that it has been developing in a tolerogenic environment during the fetal life. So we know that pups don't have a fully competent immune systems. And we know that one of the consequences, it's a strong increase of susceptibility to pathogen. And if we look, for example, to the susceptibility to parvovirus, we know that it's a deadly disease in pups, but almost an asymptomatic infections in adult dogs. So we need to keep that in mind because we have the increased susceptibility to pathogens, but we also know that the response to vaccine is less efficient in pups than in adults. So it doesn't mean we do not have to vaccinate vaccines, but we need to remember that if we vaccinate too early, the vaccine will not be efficient, or the vaccine for live attenuated vaccine can be dangerous and induce a vaccine disease. The last point is to remember that the acquisition of the maturity of this immune system is more or less around the puberty. So after puberty, we know that we have an immune response that is equivalent to the adult. Another point is, what do we do with old dogs? We often listen owners saying, oh, my dog is old, so I don't need to vaccinate it anymore. And the answer is, of course not. You do need to vaccinate it, to keep vaccinated your dogs. Why? Because we know that when the immune system is getting older, we observe an increased susceptibility to infectious pathogens. And if you look at this graph, you can see the amount of antibody against distemper virus in vaccinated dogs, and even in vaccinated dogs. When you are in geriatric group, you see a significant decrease of antibody level, which means that even with vaccination, dogs are more susceptible. And if we look to all the species, all the pathogens, we can say that senior or geriatric dogs have 1,000 times higher risk of dying from an infectious disease than an adult dog. So we need to keep in mind that core vaccine has to be done during the entire life of dogs, and don't say because he is old, he doesn't need anymore the vaccines. And for the non-core vaccine, of course, it will be depending on the risk and on the way of life of the dog. So before finishing this short presentation, I would just like to add some few points about vaccine safety, because it's some question that we often have from owners of dogs that can be sometimes worried about side effects. So do we have adverse events after vaccinations? First of all, I would like to define with you what are the vaccine adverse events. The first one is what we call the reactogenicity. And the reactogenicity is clearly a physiological reactions. It's the consequence of the development of the immune response. An immune response always starts by an inflammatory response. And what we see in vivo when an immune response starts, it's either a local inflammation with redness, heat, pain, swelling, you know what I mean, or a systemic inflammatory response, and you can have articular and muscular pains, a little bit of fever or lethargy. It is important to remember that reactogeny is physiological, but it has to be moderate and temporary. Besides that, a vaccine stimulates the immune system, and it is possible that because of this stimulation, we have adverse events. And the first kind of adverse event we can have is allergic reactions. And if we look what we have in human, we know that we have something like 0.60 report of allergic reaction per 100,000 doses injected. And among the allergic reactions, the most serious one is, of course, the anaphylactic shock. And once again, in human, we know that we have less than 1 per 1 million doses injected. So it can happen, but it's very, very rare. The second problem can be this inaccurate or inadapted activation of the immune system and the increase of autoimmune diseases. So if we look in the literature, and there have been so many studies now, we can see that there is a clear demonstration of the absence of causal link between vaccinations and development of autoimmune diseases in humans. So in human, we know that the safety profile of vaccine is excellent. But now the question is, and in dogs, what do we have? Do we have data? What kind of data do we have? So I will present you rapidly a large study on cohort done in USA on more than 1 million of dogs. Each dog received almost 3 vaccines the same day, and dogs were followed for 3 days. And this study demonstrated that we had 38 reports per 10,000 dogs vaccinated. And if we look at the result, you see that 2/3 of the adverse events reports were lethargy with fever, which means reactogenicity. And more or less 1/3 was allergy. And if we look at the deaths that could be linked to the vaccination, they observe 3 deaths. But I remembered you that you have 1,200,000 dogs, which means that the 3 deaths are very, very low and maybe not even linked to the vaccinations. And just to finish, we did in French a French study over a retrospective study, once again, over 5 years, and in which we look at all the serious adverse events in dogs. And when looking at the serious adverse events, you see that the ratio is very low, which means 0.3 per 10,000 dogs vaccinated. And half of these reactions were linked to allergy, And the other part was vasovagal syncope or injection site rate. And during the 5 years, we had 118 declarations for death without a direct link with the death and the vaccination, and which means a very, very low ratio of declaration. So globally, if we combine what we have with this US study and this French study, once again, like in human, we can say that we have an excellent safety profile for the dog vaccines, and that most of the adverse events correspond to the reactogenicity. So globally, to summarize, we have the chance to have good vaccines to protect dogs against deadly disease. And we know that the benefits are much, much higher than the risk associated with the vaccinations. And I'm sure that you're convinced that vaccination is the best strategy to protect populations against infectious disease. So I would like to thank you for your attention to this short presentation, and I will give the talk to Mary that will give information about how to vaccinate correctly all the dogs. Thank you very much, and have a good evening.